One of the areas that I want to make a video for, and hence I'm doing it now, is something that my subscribers have asked me, and that's a term called RSD. RSD is Rejection Sensitive Dysphoria. And what it means is it's basically an intense emotional response to the perception, whether that's real or imagined, of rejection, criticism, or failure. It is not an official diagnosis in the DSM-5, but it's commonly discussed in the context of ADHD, trauma histories, or attachment wounds, which is where we find it a lot. So the word dysphoria basically means unbearable emotional pain, which captures how overwhelming it can feel for those who experience this. So what do people experience when they have or believe they have RSD? They feel deep shame, humiliation, or panic when they think somebody's disappointed with them. They may withdraw, shut down, lash out when they perceive any kind of rejection, even when none was intended. They have a consistent inner fear of messing up or not being lovable enough. They replay conversations, looking for signs of disapproval. They feel intense anger or sadness, even when they're just criticized a little, and I mean just a small amount. For many, the emotional pain of RSD is instant and disproportionate to anything that took place, and it may take hours or days for them to recover. So how does it show up in relationships? Well, in couples, RSD can have cycles like misinterpretation. One partner's neutral comment, "You forgot to take out the trash," feels like a personal attack. "You think I'm lazy and useless." That's what the person with RSD is replaying. Over-apologizing or people-pleasing. To avoid rejection, the RSD partner will many times suppress needs or anxieties, leading to resentment they feel later. They withdraw or get defensive. They may emotionally pull away to avoid further pain or become defensive to protect their sense of worth. And I think a partner confusion. The non-RSD partner often feels like they're walking on eggshells, or they can't predict when the trigger of distress will happen. And often the person without the RSD thinks there's something wrong with their partner. Like, how could they be this sensitive? They will label this person as, "You're broken, you're too sensitive." And none of those are true. But the person who is sensitive is experiencing something they need to be understood about. So how can couples work through RSD without splitting? Well, the first thing is name the pattern, not the person. So it helps to externalize the RSD, the reaction, rather than seeing it as a character flaw. So for example, it seems like your RSD got triggered when I said, instead of, "You're too sensitive." Okay, so if your partner said, "You're too sensitive," and this RSD gets triggered, then they may shut down, withdraw, or get really angry and defensive about it. Create safety before logic. So in the moment, reassurance is more effective than reasoning with a person. Don't try to reason with someone who is feeling a lot of pain over criticism that you never even intended. Say, "I care about you. I wasn't rejecting you," before explaining what you meant. And emotional regulation first, then the discussion later. Establish reassurance rituals. So things like simple grounding gestures, like a hand squeeze or a phrase, "I'm still here for you," can calm the nervous system and rebuild trust faster, so that it can kind of help buffer this RSD effect. And encourage honest communication when your partner's calm. Have structured conversations when both partners are emotionally settled. What kinds of comments or situations make you feel rejected? this would be something you would ask your partner who has RSD, so that you both would be able to lay this on the table, and then it would help you label it like, this is part of the RSD situation that's coming up. It's really not you or us. It's this disorder. How would you like me to respond when this happens? Asking your partner that can really go a long ways in helping buffer and minimize the feeling of the overwhelming pain that you may feel if you feel like this is directed at you, and work on self-regulation skills. When I have a client with RSD, what I'm constantly working on is how they regulate. Besides feeling this pain, labeling this pain as RSD, as something that happens to them, how do they cope? Well, things like mindfulness, journaling, staying in the present, brief sensory grounding, like noticing 3 things you feel, 1 you hear, and 1 you see, can help slow the emotional escalade, or the buildup. And I think therapy, especially something like ACT therapy or CBT therapy, can also help teach the reframing, change of perspective, and strengthen secure attachments. Since RSD often reflects deep attachment fears that your partner who has it learned in childhood, couples therapy can help build secure, consistent responses that are predictable. And empathy goes a long way in retraining a person with RSD that most of the time started when that grown adult was a child. Reframing your thoughts. RSD isn't about overreacting. It's about overfeeling in your nervous system that's been trained to expect abandonment. So it's almost like the person with RSD has already decided when they are criticized or when they are thought less of, that the person who they love the most is going to abandon them. As I said, this starts in childhood. So their nervous system starts cranking up to build this overfeeling about what is happening, when in reality, in present day, none of that is true anymore. It's left over from something painful that happened numerous times in their childhood. And so the more we understand what our partner feels, what they're dealing with, what they're experiencing, the better we can align with them, understand them, and help rebuild the trust connection now in the relationship to make up for what that person wasn't able to get in childhood. If this video is helpful for you, please subscribe. And if you're already a subscriber, thank you so much.